Many people believe the liver is either healthy or damaged, with little room in between. In everyday conversations, liver health is often framed as a binary condition. Either a person has liver disease or they do not. This simplified view makes the topic feel distant and irrelevant to those who have never received a diagnosis. However, modern medical research suggests that liver function exists along a broad spectrum. Subtle changes in liver metabolism, fat handling, and detoxification capacity can occur years before any clinical disease is identified. These early shifts do not usually cause pain, dramatic symptoms, or abnormal routine blood tests, which is why they are frequently overlooked. Another common assumption is that liver health is primarily influenced by alcohol consumption alone. While alcohol is an important risk factor, it is far from the only one. Diet composition, metabolic health, physical activity, hormonal changes with aging, and overall inflammatory burden all play roles in how the liver functions over time. What is often missing from public discussion is not fear-based warnings, but context. How does the liver actually manage fats, nutrients, and metabolic waste on a daily basis? How does this process change gradually with age? And why do some lifestyle patterns appear to support liver resilience, while others place additional strain on it? Rather than asking whether the liver is failing, a more useful question is how liver function adapts across decades of life, and what science currently understands about maintaining that function over the long term. Public understanding of liver health is shaped by a mix of outdated information, oversimplified messaging, and wellness trends that blur the line between evidence and opinion. One of the most common misconceptions is that liver problems only arise when clear symptoms appear. In reality, many liver-related changes develop silently over long periods, often without noticeable discomfort or immediate warning signs. Another widespread belief is that the liver's role is limited to detoxification in the narrow sense promoted by popular cleanses. This framing suggests that toxins simply accumulate and can be rapidly flushed out with short-term interventions. While the liver does participate in processing metabolic waste and environmental compounds, it does so through complex, tightly regulated biochemical pathways, not through sudden or dramatic clearing events. This misunderstanding has contributed to confusion about what supports liver function versus what merely creates temporary sensations without measurable physiological benefit. Nutrition advice has also added to the uncertainty. Over the past several decades, public messaging around dietary fat, cholesterol, and protein has shifted repeatedly. These changes have sometimes led people to avoid entire categories of foods without clear distinctions between different nutrients and their biological roles. As a result, discussions about liver health are often reduced to slogans rather than grounded explanations. Age-related changes further complicate the picture. Many individuals notice changes in digestion, energy levels, or metabolic tolerance as they grow older. Yet these experiences are frequently attributed to normal aging without deeper discussion. This can make it difficult for people to distinguish between unavoidable aging processes and modifiable lifestyle factors. Because of these overlapping narratives, detox culture, shifting nutrition advice, and assumptions about aging, people are often left with fragmented information. This environment makes it challenging to understand what is supported by long-term medical research and what remains unproven or misunderstood. Medical understanding of liver health is grounded in decades of epidemiological research, clinical studies, and public health surveillance. According to the World Health Organization, WHO, and the U.S. Centers for Disease Control and Prevention, CDC, non-communicable liver conditions, particularly metabolic-associated fatty liver disease, have increased globally alongside rising rates of obesity, insulin resistance, and type 2 diabetes. These findings are based on large population datasets and are considered historical and confirmed data. The National Institutes of Health, NIH, notes that the liver plays a central role in lipid metabolism, glucose regulation, and the processing of endogenous and exogenous compounds. Observational studies published in journals such as The Lancet and the New England Journal of Medicine consistently show associations between metabolic health markers such as waist circumference, triglyceride levels, and insulin sensitivity, and indicators of liver fat accumulation. These studies establish correlation rather than direct causation, a limitation that is clearly acknowledged in the literature. Clinical trials and systematic reviews have also examined dietary patterns and lifestyle factors in relation to liver function. For example, multiple peer-reviewed reviews in BMJ and hepatology report that sustained weight management, regular physical activity, and balanced nutrient intake are associated with improvements in liver enzyme levels and imaging markers over time. These improvements typically occur over months, not days, and vary significantly between individuals. Regarding specific nutrients, NIH-funded research has confirmed that compounds such as choline and certain amino acids are involved in normal liver metabolism. Deficiency states have been documented in controlled settings, particularly in experimental diets. However, large-scale human trials examining targeted nutrient intake as a standalone intervention for reversing liver fat remain limited. Where improvements are reported, they are described cautiously and within defined clinical contexts. Health organizations also emphasize uncertainty where evidence is still emerging. For example, while some small studies suggest potential metabolic benefits from certain bioactive plant compounds, these findings are not yet considered definitive. Expert panels routinely classify such results as preliminary and call for larger randomized controlled trials before making population-level recommendations. In summary, the verified medical evidence supports several well-established points. Liver function is closely linked to overall metabolic health, changes often develop gradually, and long-term lifestyle patterns matter more than short-term interventions. Predictions made by reputable organizations consistently stress prevention, early identification, and sustained behavioral approaches, rather than rapid physiological transformation. To understand how liver health changes over time, it is helpful to look at the organ not as a passive filter, but as an active metabolic regulator. The liver continuously coordinates signals between the digestive system, bloodstream, endocrine system, and immune network. Its functions are adaptive, meaning they respond to diet, activity level, hormonal signals, and overall metabolic demand. One of the liver's central responsibilities is lipid handling. After food is digested, fats are absorbed in the intestines and transported to the liver, where they are processed, repackaged, stored, or exported. This process depends on tightly regulated pathways involving enzymes, transport proteins, and signaling molecules. When energy intake and energy use are balanced, these systems operate efficiently. When they are not, excess fatty acids can accumulate within liver cells. At the cellular level, liver cells, hepatocytes, manage fat through structures called lipid droplets. These droplets are not inherently harmful. They serve as temporary storage. Problems arise when the rate of fat delivery to the liver exceeds the liver's capacity to export or oxidize it. According to NIH-supported research, this imbalance is strongly influenced by insulin signaling. Reduced insulin sensitivity alters how the liver interprets metabolic signals, encouraging fat retention rather than fat utilization. Another key physiological process involves bile production and circulation. Bile is synthesized in the liver from cholesterol and other compounds, then released into the digestive tract to assist in fat digestion and the elimination of certain metabolic byproducts. The production and flow of bile are regulated by hormonal and neural signals, particularly those responding to food intake. Peer-reviewed physiology research shows that bile circulation is a continuous loop rather than a one-time cleansing event. Aging introduces additional layers of complexity. As people grow older, changes in hormone levels, such as reductions in estrogen or testosterone, can subtly alter lipid metabolism and bile composition. These changes are well documented in endocrinology literature and are considered normal physiological adaptations, not disease states. However, they can influence how efficiently fats are processed and transported. The liver also plays a major role in detoxification pathways, commonly described as phase 1 and phase 2 metabolism. In phase 1, enzymes modify compounds to make them more reactive. In phase 2, those compounds are conjugated with other molecules to make them easier to excrete. These processes rely on adequate availability of specific nutrients and cofactors, as described in biochemistry research. Importantly, these pathways function continuously and incrementally rather than in bursts. Inflammation adds another dimension. Chronic low-grade inflammation, often associated with metabolic conditions, can interfere with normal liver signaling. Immune cells within the liver respond to inflammatory signals by releasing cytokines that influence metabolism. Large-scale reviews in hepatology journals describe this interaction as bidirectional. Metabolic stress promotes inflammation, and inflammation further disrupts metabolic regulation. Crucially, no single pathway operates in isolation. Liver health reflects the integration of metabolic input, hormonal regulation, immune signaling, and cellular energy balance. Medical literature consistently emphasizes that these systems adjust gradually in response to long-term patterns rather than rapid interventions. From a physiological standpoint, this explains why reputable health organizations describe liver adaptation as a slow, cumulative process. Improvements or declines occur over extended periods, shaped by sustained conditions rather than sudden changes. Understanding this integrated biology helps replace simplified narratives with a more accurate picture of how the liver supports whole-body health across the lifespan. Long-term liver health is closely linked to broader patterns of metabolic and functional health across the lifespan. Rather than acting in isolation, the liver reflects cumulative exposures and physiological demands that develop over many years. Large observational studies cited by the World Health Organization and national public health agencies consistently show that gradual changes in liver function often parallel shifts in cardiometabolic risk. From a population perspective, individuals with persistent metabolic strain, such as long-term insulin resistance or central adiposity, have a higher probability of developing chronic conditions that involve the liver. These associations are expressed in terms of risk, not certainty. Many people with early metabolic changes never progress to advanced liver disease, particularly when supportive lifestyle patterns are present. Functional capacity is another important consideration. Research summarized by the National Institutes of Health indicates that liver efficiency influences how the body manages energy availability, nutrient distribution, and inflammatory balance. Over time, this can affect fatigue patterns, physical endurance, and resilience during illness or recovery. These effects tend to be subtle and progressive rather than abrupt. Quality of life is also shaped by how well metabolic systems adapt with age. Studies published in BMJ and The Lancet suggest that maintaining metabolic flexibility, defined as the ability to switch efficiently between fuel sources, is associated with better health span, even when lifespan itself is unchanged. The liver plays a central role in this flexibility through its coordination of glucose and lipid metabolism. Importantly, long-term outcomes described in the medical literature are probabilistic. Health organizations emphasize that no single factor determines future liver status. Genetics, environment, dietary patterns, physical activity, sleep, and access to healthcare all contribute. This multifactorial view moves away from deterministic or fear-based interpretations. Overall, the long-term impact of liver-related changes is best understood as part of a broader system. Sustained support for metabolic health is associated with a lower likelihood of complications and better functional aging, while short-term or extreme approaches show little evidence of altering long-term trajectories in a reliable way. Across international and national medical organizations, there is broad agreement on several core principles related to liver health. Consensus statements from groups such as the World Health Organization, WHO, the National Institutes of Health, NIH, and major professional associations in hepatology consistently emphasize that liver function is most strongly influenced by long-term metabolic conditions rather than short-term interventions. One area of strong agreement is the importance of overall metabolic health. Clinical practice guidelines highlight sustained weight management, regular physical activity, and balanced dietary patterns as foundational factors associated with healthier liver outcomes at the population level. These recommendations are supported by large-scale observational studies and reinforced by randomized clinical trials examining lifestyle modification in metabolic disease contexts. There is also consensus that early metabolic changes often precede clinically recognized liver disease. As a result, expert panels encourage routine monitoring of metabolic risk markers such as blood glucose, lipid profiles, and waist circumference as part of preventive healthcare. This approach focuses on early identification rather than reactive treatment. At the same time, medical organizations acknowledge areas of ongoing scientific debate. For example, while specific nutrients and bioactive compounds are known to participate in normal liver metabolism, professional guidelines generally do not endorse isolated nutrient-based strategies as primary interventions for liver health. The evidence base for such approaches is considered incomplete, and further large-scale randomized trials are frequently recommended. Finally, there is clear agreement on what remains unsupported. Detox regimens, rapid cleansing protocols, and claims of accelerated liver restoration lack sufficient clinical evidence and are not endorsed by authoritative medical bodies. These positions are articulated in consensus reviews published in peer-reviewed journals and public health guidance documents. Overall, expert consensus favors gradual, evidence-based approaches grounded in metabolic health, while maintaining a cautious stance toward emerging hypotheses until they are validated through rigorous research. From a public health perspective, discussions about liver health are most effective when they focus on general principles rather than individualized solutions. Major health organizations emphasize that the goal is not to optimize a single organ in isolation, but to support interconnected systems that influence long-term metabolic stability. One widely supported principle is consistency. Research reviewed by national public health agencies shows that sustained lifestyle patterns, maintained over months and years, are more strongly associated with favorable liver-related markers than short-term or intensive efforts. This applies to dietary habits, physical activity, sleep routines, and stress management. Another key principle is balance. Evidence-based dietary guidance does not promote extreme restriction or singular superfoods, but rather encourages diverse nutrient intake that supports overall metabolic function. Similarly, physical activity recommendations prioritize regular movement adapted to individual capacity rather than high-intensity approaches that may not be sustainable for everyone. Public health frameworks also stress the importance of informed dialogue with healthcare professionals. Individuals are encouraged to discuss questions about liver health in the context of routine care, especially when there are existing metabolic conditions, medication use, or family health history. This ensures that decisions are grounded in personal medical context rather than generalized advice. Finally, health authorities highlight the value of monitoring over time. Periodic assessment of metabolic markers allows trends to be identified early, supporting preventive strategies rather than reactive responses. This approach aligns with a broader public health goal, empowering individuals with knowledge while avoiding unnecessary alarm or oversimplification. Understanding liver health requires moving beyond simplified narratives and short-term solutions. The scientific evidence consistently shows that the liver adapts gradually in response to long-standing metabolic conditions, lifestyle patterns, and physiological changes associated with aging. This perspective replaces urgency with clarity and emphasizes informed, long-term thinking. Rather than focusing on dramatic claims or isolated interventions, credible medical research points towards steady support of metabolic health as the most reliable way to preserve liver function. This includes awareness of how nutrition, physical activity, sleep, and hormonal changes interact over time. Importantly, these factors influence probability, not certainty. There is no single action that guarantees a specific outcome, and there is no single pathway to maintaining health. Empowerment comes from understanding how the body works and recognizing where evidence is strong, where it is still developing, and where claims exceed what science can currently support. By engaging with reliable sources and maintaining open communication with healthcare professionals, individuals can make decisions grounded in context rather than fear. A thoughtful approach to liver health is not about urgency or perfection. It is about consistency, perspective, and aligning daily choices with what is known to support long-term resilience and quality of life. This content is provided for educational and informational purposes only and is not intended as medical advice, diagnosis, or treatment. It does not replace consultation with a qualified healthcare professional. Health conditions, risk factors, and medical needs vary between individuals, and decisions regarding health should always be made in collaboration with licensed clinicians who are familiar with your personal medical history. The information presented reflects general scientific understanding at the time of production and may evolve as new research emerges. Viewers are encouraged to seek professional medical guidance before making changes related to diet, lifestyle, supplements, or healthcare routines.